Well, there's a closely guarded secret in our hospitals.
The Centers for Disease Control say more people die from hospital infections than from homicides, AIDS, and car accidents combined. Investigative reporter Lisa Zigman says Missouri law now forces hospitals to give details. Lisa?
Missouri is one of only 3 states requiring hospitals to report infection rates. We can show you which local hospitals have the highest rates.
She was the best mom that you could ever ask for. We were very close. She was just, she was my best friend.
On July 6, 1999, Kim Gardner's mother had a heart attack. An ambulance rushed her to St. Anthony's Medical Center.
They performed a quadruple bypass.
Gardner said her 55-year-old mother recovered and was about to be released when a staph infection invaded her bloodstream.
The infection started raging through her body. It was shutting down her organs, and she went into a coma.
In 10 days, Sue Daffron was dead.
No one should have to see their loved one pass away like that. They had to put gauze over her eyes because the infection was coming through her tear ducts.
Gardner believes the staph infection seeped into her mother's IV, or central line. Health experts say it is where most ICU infections begin.
We see about 90,000 deaths a year related to hospital infections. But what
Eddie Hendrick knows that national statistic will likely rise if infection rates aren't brought under control. He says the Missouri law aims to do just that. The first reported data targeted central IV lines, like this one, in the ICU. The statewide infection rate is 2.7 for every 1,000 days a central IV line is in place. The national rate is 3.6. DePere Hospital had an infection rate of 8.5. That is more than 3 times higher than other hospitals in Missouri and more than double the national rate. Jefferson Memorial in Crystal City, Missouri, had the second highest infection rate, followed by Forest Park Hospital in St. Louis. DePere and Forest Park sent statements saying administrators have made changes in hospital practices. Jefferson Memorial's statement said the spike was a coincidence that had more to do with patient mix than poor procedures. All 3 hospitals indicate the next set of numbers will show lower infection rates. While you can't compare large teaching hospitals like St. Louis University and Barnes Jewish to others in the state fairly, you can compare them to each other. Barnes Jewish Coronary ICU had more than 1.5 times the infection rate of St. Louis University Hospital. Is SLU doing a better job at infection control than Barnes Jewish?
I don't think so.
Dr. David Warren is the infection control medical director for Barnes Jewish Hospital. He said the state's reporting standards need to be fine-tuned and that this initial data doesn't paint the entire picture. Hendrick doesn't disagree. And he says consumers shouldn't make healthcare decisions on these numbers alone.
It doesn't say that a hospital is bad or good. What this number tells me is there's a number that's not standing up to the peers in this area. I want to know why. I have a right to know why.
Neonatal intensive care units treat the sickest babies. When we looked at the data for St. Louis neonatal hospitals, Children's Hospital had an infection rate nearly 5 times higher than St. John's or Cardinal Glennon.
We actually already have gotten the numbers down.
According to Dr. Alexis Elward, new data from Children's will show significant improvement. Since hospitals report all the data, how do we know that the infection rate numbers haven't been manipulated or altered or simply not reported? The state law allows investigators to spot audit, and if discrepancies are found, there could be serious penalties against the facility's license.
I had to fight, and I had to be her voice, and I had to go to Jeff City and lobby.
Gardner's efforts helped bring about the state law mandating public reporting of hospital infection rates.
I know she's proud, and that's all that matters. That and that her death will save lives.
Several hospitals, including Missouri Baptist, St. Anthony's, Christian Northeast, and St. Luke's, had average scores, no red flags. St. Joseph Hospital in Kirkwood had no infections. We're going to show you how to find out about infection rates at any Missouri hospital. Just visit KSDK.com and click on Top Story or Investigations.
Great advice. Thank you, Lisa.